the patient's breast is unharmony from her body, the patient must have go to breast aesthetic surgery. One of them is breast lifting surgery. Areola must be near the half of the arm length. That means if the areola under the half of the arm length, that breast is very sag. With the sagging, the breast sagging is mismatching of the skin and gland. With hormonal changes or very loss of weight, breast can be sag. The breast lifting surgery can be using for corrective sagging breast. For this surgery, the patient mustn't have any serious health problem and the breast have not serious problem. If the patient have very big serious problem, we cannot do this operation. But if the patient have under the control diabetes or hypertension, we can do this operation. If the patient's breast have very serious problem, we cannot do. For this, before the operation, we are control the breast health with ultrasonography, mammography or breast MRI. This surgery can be performed under general anesthesia. Before the operation, we are speaking with the patient. What the patient wants is very important for us. If the patient says, I don't want the big breast, I only want not hugging breast, we are not using prosthesis. If the patient says, I am wanting not sagging and bigger than this breast, we are using with prosthesis. With prosthesis, breast lifting is gold standard or nowadays. After breast lift surgery, generally the patient stay in the hospital one night, but sometimes if the patient have some problem like diabetes or hypertension, or the patient have another problem, the patient can stay 2 nights in the hospital. Nearly 3 months later, the breast result can be visible nearly 3 months later. Yes, the patient's breast can be sagging again because breast tissue is very soft tissue and breast ligaments are very thin ligaments. If the patients have hormonal change, if the patient's weight changes too much, and if the patients have very micro trauma, the patient's breast can be sagging. After the operation, the patient has scar. We are using some kinds of techniques for breast lifting. Some technique we are using lollipop scar. That means perioreolar incision and only vertical incision on the inferior area of the breast. Some kind of technique we are using inverted T shape of the scar. If the patient says, I don't want these scars, especially vertical scars, we are using huge breast or very bigger breast, and we are using only very little submammarial sulcus scar, like a breast augmentation. But we must choose bigger prosthesis because we have big skin and very little gland. That's result sagging breast. For the sagging breast lifting, we must use bigger prosthesis for little scars. If the patient says, I don't want bigger prosthesis, we are using lollipop scar or inverted T-shaped scar.